youth in public schools post-COVID-19. I am a special education counselor for a public school district, but for the purposes of today's presentation, I would like to note that I'm presenting independently in a personal capacity and not representing my school district in any shape or form. These are, like I said, my personal opinions and information I've gathered in a personal capacity, and I'm not representing my school district today. So when looking at the impact of COVID-19 on mental health in our public schools, we realized that about 70% of public schools here in the United States reported an increase in percentage of the students seeking mental health services at school since the start of the pandemic. And that could be direct services, consultation services, resources, and then roughly about 76% of schools also reported an increase in staff concerning their voicing their concerns about the students exhibiting symptoms such as depression, anxiety, and trauma. And that could be school staff, whether it's teachers, principals, just anyone in the actual school setting. And we have about 88% of public schools that do not strongly agree that they could effectively provide mental health services to all the students in need. So we have a very high percentage of schools that feel like they cannot provide the services needed for the students at the moment. The three top limitations that were identified by the schools that limit their ability to help these students and provide services, mental health services, were insufficient number of mental health professionals to manage their school's caseload. Personally, I have over 50 students, and that makes things very difficult. I'm sorry. So it's such a high number. Some of the students need a lot more direct services, but it is almost impossible. There's about 7 of us for the entire school district. It was a very new role that started about 5 years ago. So our schools are very delayed in having those mental health professionals ready and available to serve students. Another one of the limitations is inadequate access to licensed mental health professionals. Here in the United States, we actually have a very high shortage of licensed specialist school psychologists. And then we also have a very low number of mental health professionals that are licensed to the capacity where they could work in the schools, and inadequate funding for those programs. Some of the causes that we've noticed that really kind of exacerbated the difficulties of the mental health of our students were things like physical distancing. So it was like the lack of connectiveness to schools, teachers, and peers, whether it's as a support system or because the schools and teachers and peers provide those resources needed for the students. We also noticed isolation was a big one. Like I said, the lack of connectiveness to some of those support systems. And we've also noticed that the religious support was also a big topic, that it kind of created a huge disconnect. And we realized that weekly attendance at religious services has been associated with a 5-fold lower suicide rate compared to those who do not attend. So some of the support systems that were there before COVID, or just the ability to access those were hugely impacted. Barriers to mental health treatment, and whether that's cost, availability, transportation to those things, that was also a huge impact. Just the general anxiety about family, health, economic problems, social problems, any of those things. And then, of course, if you were directly impacted through illness, or your relatives are just dealing with the illness in general during this time, was a lot more difficult because of the lack of medical resources and a lack of access to those resources. And then access to food for a lot of our students from low socioeconomic families. their access to food is largely dependent on school, and sometimes those are the only meals students get during the day. We did work hard to provide access to that food through the schools, but it was normally in a pickup type of situation. So we would have the food available at the home campuses, but the students and the families were still the ones responsible to get to school to get those things. So that was a huge barrier for a lot of our students. And then the disparities in computer and high-speed internet access when we switched to virtual. Again, a lot of our students and families from low socioeconomic families, they didn't really have access. They didn't have enough technology for all the students. Again, the district did provide, whether it was Chromebooks or iPads. Sometimes the internet just was not at a high speed availability to all the students if there was multiple students in the family. And also the lack of space and privacy for the students made it very difficult. So even if you had access to these things, but there was 5 other brothers and sisters in one room, it was very hard for the students to get the information they needed. And we were trying to provide mental health services to the students virtually also. But that also became very difficult with confidentiality, as a lot of the students weren't able to be in a private space and have those candid conversations. One positive note about this was that it may be that since students were at home together with their siblings or their parents, adults might have been more aware of suicidal thoughts and behaviors just because they spend more time with them. So it might be more likely that they were able to take their children to an emergency department or get those resources just because they were there more, spent more time together, and they could really see those differences in their students. So as social distance impacted everyone, especially those in rural communities that were already struggling to get these services. I have a little graphic here that kind of shows the rates of suicide here in the United States based off the rural areas. So a lot of our less populated areas, they have a higher impact rate of suicide and suicidal ideations. Ways that we tried to combat social distance were kind of the shift from social distance, or I'm sorry, physical distance and not social distance. So having that separation, but not necessarily becoming distant socially. So we shifted the focus to try to stay connected and maintain meaningful relationships, whether it was by phone, video, especially with those who have high risk factors for suicide or mental health illness. A lot of the rules and regulations in regards to mental health became a little bit more lax during this time, just because we were using mental health, but not to the capacity that we needed it to be available at the time of the pandemic. We also had increased access to mental health. Like I said, we did shift our focus and some of our regulations to make mental health more accessible, and even a lot of the medical insurance companies would cover this, and sometimes they wouldn't normally before. So there was some shift towards that. And then a lot of the programs did create distance-based suicide prevention, and those were either telephone-based contact and outreach. There was a lot more options to either call, text, or chat or video chat with mental health professionals, like suicide hotlines, texting hotlines. And then there was also a kind of influx in distance-based suicide prevention, and some of those were brief contact and interventions, which was also telephone-based. And then a lot of people tried to become more creative and do either letters, videos, or use social media in a way to contact other people or just kind of stay connected to the world. And then there was a huge increase in our efforts to lock up medication and get rid of medication that was either not being used or medication that was dangerous to students and youth, or even just people in general struggling with mental health. So there was a big effort to kind of lock up that medication or get rid of it if it wasn't being used, just because of the increase in suicidal ideation here in the United States. So here we have some information of suspected suicide attempts here in the United States. In the blue, it's from summer of 2020, so it was fresh into our pandemic. It kind of started impacting us around March. That's when most of our school districts kind of went virtual, March of 2020. So on the left, we have the information of about 26% of females from 12 to 17 reported, or it was reported that there were suicide attempts by them. From males ages 12 to 17, there was about 11%. And we saw a huge jump from summer 2020 till winter 2021. It increased from 26% in girls to 51%. And it was actually a decline in the ideation of males from the age 12 to 17. There was, the way they gathered this information was from emergency department visits. So we got this directly from emergency department information throughout the United States. Average emergency department visits for mental health concerns and suspected child abuse and neglect increased in 2020 compared to 2019 in general. So whether that was related to suicide, just mental health, or physical and mental abuse, we also saw that increase. And then the risk factors in suicide attempts also increased. Again, a part of it was a general society-based pressure, and a lot of it was also just the increased general anxiety and community anxiety based around the uncertainty of COVID, when things were going to return to normal, what normal would look like. So we did see an influx in all of those areas. This information's locally from our Texas Poison Control. This data also shows a sharp incline in suspected suicide cause from girls. In both of these graphs, it's separated by age. So the one on the left is from 6 to 12-year-old children. The blue line is our female students, and then the red line is our male students. So there has been an increased amount in general, but there was a spike between around 2020 and 2021, and the data shows that there's still a rising increase in those suspected phone calls, but it just hadn't been released just quite yet. And then the graph on the right shows the same information, but for 13 and 19-year-olds, and it's very parallel to the younger girls. The rate of the boys kind of stayed the same. The males, we just noticed a sharp increase in what our female students were experiencing. Part of this is also just lack of access to mental health services in general. That part of that, we understand that it may not have anything to do with COVID-19 and the pandemic, but I think it exacerbated the need and then the struggles for the students. And then, like I stated earlier, child psychiatrists, psychologists, and therapists tend to have caseloads that are tapped out, like they cannot take any more students at the moment, and there's long wait lists. And then we also noticed that emergency rooms and behavioral and psychiatric hospitals are overflowing with pediatric patients, and some of our in or outpatient services have long wait lists, up to like several months of wait lists for students to be able to get access or get those resources. So we went over the information locally from here from Texas, but universally this was kind of seen throughout the United States. Interestingly enough, this information is from the Washington Poison Control. so it's across the country from us here locally in Texas. And the increase of suspected suicide cases phoned in, and this was to, again, the poison control. It increased from younger students to older students. And then our females did show a sharp increase in those suspected phone calls as compared to the males. The males stayed fairly in line to the trends that they were currently seeing, but there was a sharp incline in what our females, our teen females, were experiencing. Suicide attempts involving substances arose across the board between 9 and 18-year-olds, but the data does suggest that our youth are experiencing a mental health crisis across the country. And it's impacting a lot of our younger students a lot more now that we had previously seen. It's actually pretty rare for children and teenagers to die by overdose or poison. But almost 29% of the cases do have moderate or major health effects on the children and teenager after attempted suicide by substances or whether that's medication, just general household items. We do normally see around a 30% of people affected moderately or major health effects from those things. Children are sensitive to kind of what's happening in their environment. And as a confluence of those events, such as like the pandemic, just the opioid crisis, political unrest, and climate change, children may feel less secure just in general and across our country. 10 to 12-year-olds may be less likely than older peers to have a grasp of consequences of their action. This information in the slide before is specifically information we gathered from poison control. So it's suspected that some of the younger students may not grasp the concept of their actions, along with their impulsivity and just that ease of access of some of these substances and medications can contribute to the rising behaviors and the rising rates. And it's kind of believed that a lot of our younger students may not understand the concept of death and its permanency. I think sometimes they get caught up in the emotion they're feeling or the experience that's going on, and they don't really realize the permanence of these actions that they may attempt. So we have been actively trying to work to identify the students and the children in need of mental health services. Some of the challenges that we have seen across our district and nationwide is that it is normalized to view girls as dramatic and emotional. So that's something that female students are often kind of overseen just in general because it's normalized here in our country that most females will kind of either be overly dramatic or make things bigger than they are. And then we also have noticed that female students also internalize their behaviors more than our male counterparts. And males usually show more visible signs in the school setting, whether that's behaviorally acting out, their changes in mood, just voicing their concerns more. In the school settings, a lot of students who are not a behavior concern are not outwardly showing these signs of emotional distress are often overlooked for referrals for additional support, just because if you're not a problem in the classroom, it's okay. You can sit there quietly and everything's fine. Another thing is cultural and gender biases make it easy for girls to be overlooked. The culture of minority communities makes it very hard because a lot of these cultures represent women as stoic and strong. So a lot of the times it's normalized for girls to be tasked with dealing with their emotions on their own, since they also have to be the ones watching over the needs of their loved ones. And then also the stigma of seeking mental health treatment. that's also greater in women of color. So that's something that we've also seen. And then again, a lot of the students or the female students are dismissed because it's typical teen or teen behavior, or they're seen as moody or hormonal teens. So that's something that we've also struggled to deal with and kind of create that separation. When we look at what can be done to health here at school, some of the things that we have seen are open discussions and lessons on mental health and social emotional learning. And that's district-wide, like adding direct lessons as part of the curriculum and built into the school day. Our district tries to do at least 30 minutes of these social skills lessons and these mental health topics. Campus-wide trainings for staff to look for signs of mental health struggles. And a lot of that was training on what to look for in the classroom, warning signs for a lot of these mental health things that we see in a way in a school setting. Up-to-date resources and referrals for community resources. So these are community resources that are accessible and available for students, whether it's free or in the area, or there's public transportation available to those locations. And then professional mental health staff available on all campuses. We did create a crisis counselor position who is there just to work on mental health struggles. That's available to all the students whenever they need to. And then regular universal screenings for all students and follow-up. That's something that our district has personally struggled with. It's something we want to implement, but it's just kind of hard to regularly do those things in a large setting. And then parent trainings, we do try to have trainings for parents available just to make them aware of some of the symptoms and the struggles we're seeing. That way, if they suspect these things, they can kind of work with us and partner with us to help these students. And again, we also try to work on adequate staff and caseloads that are manageable. And again, that's a struggle just because of the funding for these services and just the lack of people who are licensed that are available to work in the school settings, because most of our mental health service positions require at least a master's degree and to be licensed at a state level. But I believe, okay, so then this is some of the information from where I gathered some of my information for this presentation. And I believe that is all for me. Thank you so much.
Thank you, Ms. Salas. Thank you for giving an overview of like what the American youth, especially like the girls at school that are experiencing, but some illuminating and like positive solutions that are being implemented to try to address the increased need and the stigma against like girls experiencing mental health needs. So we'll further conversation at the end of the panel. And so we'll move on to the next one. The next presenter is Professor Xiangwan Yan. And she'll give an overview of the children's placement policies and measures in Taiwan. Dr. Yan is a retired professor, but as a passionate social practitioner, she is still busy advocating for social justice, especially on gender justice, along with race and class, and also alternative care for children deprived of a family environment. Currently, she is also a member of Taipei City Gender Equality Education Committee and also a board member of MHAT, an advisor of Hand Association of Taiwan. During the COVID-19 pandemic, the measures or programs that government, corporations, and organizations designed for creating job opportunities for women and maintaining work-family balance for all workers will be her interest. And she will give us a slice of that in her presentation today. Professor Yan.
No, it's okay. Can you hear me?
Okay.
Okay. Good night and good evening to all. Join us, friends from the world. It's a pleasure to be here to talk about COVID-19 with those disadvantaged women and girls. We specify to talk about children's placement policy and measure in Taiwan. Taiwan have signed a couple bills on human rights, including CEDAW, Women's Bill, and CRC, Convention on the Right of a Child. But Convention on the Rights of a Child rarely focus on gender impact analysis. That's why we pick up this topic. And again, today, I only just focus on overview, what's the policy and measures in Taiwan and what we can do. So what's the problem? Institutional care. And majority of the placement policy right now, or currently we have using is institutional care. And even last year, we introduced the policy for the alternative care of children will change. So that's our focus. Okay, so why not resettle children? With increasing awareness of child protection in Taiwan, the child abuse report has risen from 59,915 in 2018 and to 79,328 in 2021. And the child abuse every 7 minutes, it happens, and 80% of abuse are parents. Whenever an incident hits the news page, people will always say, why not resettle children? What happened? In fact, with the introduction of international convention in recent years, just mentioned before, taking children away from their original family is no longer the primary direction of children's placement. We have complete twice state report on the CRC. The first one is reported as completed in 2017. The second one is just completed last year. So when we introduced we have an international committee come to review. Institutional care is the majority of Taiwan's children's placement outside their home, accounting for 60% of the children, and the number of people placed in non-public institutions continues to grow. The excess number of institutions may leave children being placed in institutions while not receiving care that is primary in a home environment. And last year, the second state report found out as the number of institutional placement, foster care placement decreased. However, about 90% of children who were reported to have been abused who stayed at home. Nearly 10% of children were abused again within 1 year after they returning home. So we got a question, if the original family is broken and difficult to reunite, what should the children do? Can the government help children rebuild a home where they can grow up with peace of mind? How can the network outside the system extend a key helping hand to marginalized children? That's our question. Predicaments. Use the out-of-home placement as a large result for as short a period as possible. Due to the comprehensive factors such as increased investment in foster care and relative placement resources, the number of children placed in institutions has dropped significantly. While families willing to provide foster care face the reality of aging and lack of new blood. But interesting, lately, Taipei City government just restriction the age line to 45 to 65. They can apply for be foster care family. So it's kind of interesting. It's an aging society, so that's really one of the problems. So what's the contribution for the second state report of CRC? They finish up the Suicide Prevention Act 2019. So it's almost the same to compare to what Erica just presented. The suicide for teenagers is increased. The Protection of Children Youth Welfare and Rights 2021, Human Rights Action Plan 2022 to 2024, and the Policy for the Alternate Care of Children 2022. So just right before we finish up the second state report. So we are going to focus on this one. And policy of the alternate care of children in Taiwan emphasize place on preventing the needs for resource alternate care. Also, the committee recommend that policy that special attention to be paid in enabling family to care for children with a disability, including through promoting and facilitating self-help groups and these parents and guardians, and then where necessary, providing for respite care arrangement. So that's the big part. Another part is government to designate small group home as a statutory form of alternate care enhanced. When residential care is deemed to be in the best interest for the children, to prioritize consideration of a placement in that care setting than in a larger facility. I think that's the one big achievement, but the scale is really limited, small and limited. Community recommend that government allocate adequate resources to improve this objective. Money. I think Erica just mentioned the allocate money, financial aid is really important, financial funding. Again, committee found out not only majority of residential facility is provided in private private provider. Also concerned about we don't do that much inspection, which show that it's only certain private run facility being evaluated as requiring urgent and substantial improvement. So again, committee strongly recommend initial licensing of private facility aligned to need and subject to more stringent conditions. And through effective gatekeeping and other measures, reliance on the private sector provision for alternate care be reduced to a level that can be independently and effectively monitored on a frequent and regular basis. And we need to follow guidelines for the alternate care children, UN regulation. And government be urged to ensure that quality of care in private residential facility, including through the recruitment and retention of a adequate number of qualified staff, is not compromised by facility inability to secure appropriate funding from non-state resources, and recommended that financing of private care provision be subjected to in-depth examination. That's a long time problem. Again, with concern that report significant number of residential care facility, they found out inappropriate surveillance and disciplinary measure, as well as a potential unduly restrictive condition on privacy and everyday life. They cannot using computer, they cannot access the internet. So that's all happen in the facility, residential facility and larger facility institution as well. So the committee also encouraged government to carry out an in-depth steps, evaluation of outcome of current facility provision for securing the successful return of children from family-based residential alternative care to the care of their family, and enabling caregivers who are unable to return to their family to transition to a suitable and safe setting, including semi-independent living, especially those after 18 years or old. They cannot really independent living. Plus, International Review Committee notes that while alternative custodial sentence exists for persons in conflict with the law, the discretion of the court of the prosecutor, sentencing guideline for court, there is no sentencing guideline for court dealing with the parents, guardian, and children. So committee urged government to draw up in consultation with a representative of the judiciary and other relevant actors, including children, sentencing guidelines specifically for such cases. And these guidelines should bear in mind the right and best interests of children in such a situation by recommending and courts impose custodial sentences only in exceptional instances to avoid separation of children from their parents and guardians, as well as potential placement in an alternative care setting. We do have a multiple agencies involving to take care of those alternative care policy. So the last question will say, children stay in their original family is really the best interest of the children. We found a couple problems, hidden worry that cannot be ignored. Long home restoration period and risk signals. According to the survey report by the 监察院 Supervisory Council, the past 3 years, from 7.7% to 10% of the children who return home after being resetting as children protection case with 1 year. Sexual assault at home actually is incest. Parents in prison or mental illness, the most difficult way for children to return home. Such as incest cases, sometimes the family will protect the perpetrator, blame the victim, or blame the child for speaking indiscriminately. How will the child deal with the trauma? How to face the family and rebuild the relationship with the family? It is not easy. Again, another problem is the risk of hasty case closure behind out-of-home placement policy. So we suggest we would do restructuring institutional placement, including alternative care, needs assessment, including gender impact analysis. That's what we really need urgently. Staffing and training of agency placement. So that's for now, we suggest these two and the big text. So thank you for your attention. Let's work together. Thank you.
Thank you, Professor Yan. Thank you for highlighting. Okay. Sure. Yeah. Thank you again for Professor Yan for providing, pointing out the systemic issues that has, been happening, but even before COVID-19, but like the 2 recent reports is able to specifically pinpoint and remind us that, it's still the systemic issues still persist, but also offer specific obtainable objectives that these placement agencies, these multi-level interventions that is required to be able to ensure to increase gender equality and decrease gender disparity. We'll move on to the next panelist, which is Miss Mei Yu Huang, and she'll be sharing the stories of women and girls in placement agencies, specifically focusing on Taiwan prison and correction facilities during the COVID-19. Ms. Huang is a social worker and social practitioner studying for a doctoral program in the Institute of Multicultural Education at Donghua University. She is currently the Secretary General of Hand Association of Taiwan. Her main work projects are gender justice and HIV positive addiction service support. In recent years, she has been actively engaged in social dialogue work, including the project on Chrysanthemum Monologue. So I'll hand it to Ms. Huang.
Okay, hi, everybody. I am 有声音吗? Okay, I'm Meiyu Huang, and I'm social work, and I work in Hand Association of Taiwan, and this is my topic, Agency of Correction, Minister of Justice. Okay, so every week I go to the prison, but when 2021, the prison stopped our class, so we just wait, but we can't do anything, just wait. And the agency I talked about is including in prison, detention centers, drug abusers treatment centers, skill training institute, juvenile detention house, juvenile correction school. And here are about 50,000 male inmates and 5,000 female inmates, including 2,500 underage male students and 250 underage female students. Most of adult female inmates are between the age of 30 and 50 years old, and most of underage female students are between the age of 15 and 18 years old. Okay. And the epidemic in Taiwan became more serious in May 2021. All schools are closed. Remote work and family visit in agency only for video call during epidemic. Then the classes stop and the counseling stop too. So outside teachers and counselors banned from entering agency to provide service. Staff working in different offices, daily testing for infection and isolation of infected individuals. Vaccination for all staff and inmates, and provide mask to inmates for free. Faster release of inmates on parole and fewer new cases. Okay, so we can see the number here. See the male, they only 6,500, more than 6,000 fewer than female. We can see fewer 700. Okay, in 2021. The real situation inside the agency is half of agency contain too many people. 7 agency with an over capacity ratio exceeding 20%. Difficult to isolation of patients during the epidemic. All the epidemic were kept in the same room and only give them common cold medicine. Sometimes the guard even forget to give them the medicine because they are not paying attention, because there is not enough guard to work and they are very busy. Private only 1 mask per week to inmates. In order to avoid being arranged to live in another isolation room and the lack of isolation space, inmates began to refuse to report the infection as long as it is not serious, and neither would guards. So, almost all classes are stopped. All counseling courses are stopped, including individual and group. At the beginning of epidemic alert level 3, the juvenile correction school required teachers to come to the school for face-to-face lecture, but the teachers were unwilling, so they changed to watching video tapes later, resulting in a decline in learning. Most of inmates were locked in the room for a long time and could not come out. So the inmates' violation began to increase because of emotional stress. And some families are too old to use the internet. So the families and the inmates can't see each other. The inmates of violation and prison copy stages. Okay. Some male inmates entered the ISO in demand medicine and grocery. So they start to get him. Then they start getting medicine and grocery and allowed to smoke in the room. But female inmates' violations are passing notes to other people or minor argue to or writing letter to family members to complain, but nothing changed. Because most inmates just want to finish their sentence and go home quickly. They don't want to be seen as a trouble or even affect their parole application. And in 2022, internal teachers to be allowed to serve in agency again. During the course, the inmates looked like they had survived the catastrophe, and one huddled in a corner with a pale face due to symptoms in my class. So we regularly know that most of inmates inside have been infected with COVID-19. And they say maybe probably due to almost 100% vaccine coverage, no inmates die for COVID-19. But there may be more problem with the young agents, but we still waiting for the official report. Okay. This is mother-child in prison. In Taiwan, about 400 children live with their mothers inside the prison. Children under the age of 3 can go to the prison with their mothers, and when they are 2, they can go to preschool outside. But during the epidemic, children stop to go to the preschool and imprisoned with their mother for a long time in a room. And so many inmates lived together. Children face the problem of high infection risk and insufficient education stimulation. So is there any support private? We don't know, because until now we still not see any report, okay, from government. So I think too many things we still don't know now. The government didn't give more report till now. So maybe Professor Yan and me, or we are still try to do some research about the quality and the quantity, and what did they do between COVID-19. Thank you.
Thank you, Ms. Wong. I definitely, coming from the U.S. perspective, I think that kind of echoes like what we've seen in the U.S. prison population as well. Obviously, before the pandemic, they are already, marginalized population that already doesn't have enough resources, similar to, what Erica is saying at schools, but even so for prison populations, right? And so with already underfunding, under tracking, it's even more difficult to, give them more priority to get the resources, social resources that they need to help them to, whether they're for their well-being while they're in prison, or set them up for success to transition back to society when they're out of prison. And so I'm definitely looking forward to further discussions. And so we'll next go to our last but not least panelist, Ms. Xianmei Tang. She is currently the Deputy Secretary General of the National Alliance of Mothers for Family and Childcare in Taiwan. And as part of a representative for the organization, they're very concerned about the importance of women's role in family motherhood, and that they hope to promote the importance of division of household chores and flexible working hours for women, so that women can value their families and make a successful life for themselves at the same time. And she'll be sharing their projects that they've been working in rural areas for girls. Please go ahead.
好，大家好，我是台湾全国妈妈护家护儿联盟副秘书长，我是唐先美。那我用中文，所以我请一位翻译帮我翻译。好，有请单信爱。
Hello everyone. I'm Tang Xianmei, Deputy Secretary of Taiwan Mothers Alliance. And I'll speak in Mandarin, and Ms. Shan Xin'ai will help me to translate.
好，那妈妈盟是由一群爱家护儿的妈妈们组成。我们是基于孩子的需要，妈妈最知道，自己的孩子自己顾，别人的孩子也要顾，这样的理念而成立的。
The Mothers Alliance is formed by a group of mothers who love and care for their children, for we believe that mothers know the needs of their children best, and mothers should take care of their own children and other people's children as well.
我们认为教育是影响孩子一生最重要的工作，而家庭是孩子来到世上第一个接触教育的环境。
We also believe that mothers are the stabilizing force in the family. Whether working or not, mothers need support and companionship in raising children and managing family relationships as well.
妈妈是成为家庭稳定的力量，不论妈妈是否是全职妈妈，或是在外面工作，在教养子女上，或是在家庭关系的经营上，都是非常需要支持跟陪伴。
刚才漏翻译。Okay. We think education is the most important thing that affects child's life. So we believe that every mother, whether working or not, mothers need support. and companionship in raising children and managing family relationships as well.
那我们特别是看到在云林偏乡的弱势的家庭的一些需要。好，那这几年呢，因为加入了我们在台湾全国的家长这样的一个组织，再加上我们的理事长是本身是云林人，所以接触在云林偏乡的一些弱势家庭，我们看到了这些家庭的需要。
In the past few years, because we have joined the National Parents Alliance and our chairman is from Yunlin, we have come into contact with the needs of some disadvantaged families in the remote areas of Yunlin.
我们发现呢，在云林偏乡还是有很多男尊女卑、重男轻女这样的观念非常的严重。在偏乡妇女常常夹在父权的压力跟孩子青春期的需要这样的一个反抗中，以及自身为平衡维持关系的这样的一个痛苦，这个妇女在这样的一个痛苦不堪的情况。
We found that women there often caught between the pressure of patriarchy and the rebellious of children's adolescent needs. 有声音吗？有。
再加上还有新住民来台湾结婚生育子女后，面临的难题呢，就是没有能力可以教养好自己的孩子。在于他们的文化的差异，还有语言能力的不足。
In addition, Yunlin has a high proportion of elderly people and parents need to go out to work. So the intergenerational parenting is common. There are also new residents who come to Taiwan to marry. The problem is that they are not able to raise their children well.
他们希望帮助孩子监督家庭功课或是写作业的时候，也常会感觉到自己的能力是不足的。但很可惜的是，很多新住民的老公他们是不会协助，通常把这样教养的责任是推给新住民妈妈。
Due to cultural differences and lack of language skills, if they want to help their children to do homework, they often feel that they are not capable. Unfortunately, the husbands are not willing to help them.
所以在我们所接触的女童当中，发现她们在生活中面临到一些危机。
Therefore, among the girls we have contacted, we found that they are facing some crises.
例如说，我们在中心有一位女孩，上面有2个哥哥，因为家里重男轻女，从小她就不被家人重视，哥哥也都不怎么理她。而她的家人是从事在市场卖鱼的工作，清早就要出门工作。
For example, there's a girl in our center who has 2 older brothers, and because of gender biases in the family, the girl was always overlooked, and her parents is selling fish early in the morning every day in the market.
女孩从小呢，没有人教导她在生活中如何做好基本清洁，头发也是没有人帮她梳理，衣服也不干净，连带影响她在学校和同学的相处，同学会排挤，不想跟她玩。
So the girl was never taught how to do basic cleaning for herself, and no one helped her comb her hair or wash her face. So when she goes to school, the classmates will reject her and don't want to play with her.
另一个女孩呢，因为父母工作忙碌，也要身兼家长的工作，在家照顾年纪较小的弟弟妹妹，因而没有太多时间跟同学有互动。
And another girl, because her parents are busy with work, she has to take care of her younger brother and sister at home, so she doesn't have much time to interact with her classmates.
而这些女孩们从小在家庭当中自我形象不好，到学校人际关系又有问题的情况下，很容易就成为被霸凌的对象。
And these girls who have a bad self-image in their families and have problems with their interpersonal relationship at school, they are easy to become targets of bullying.
再加上现在网络交友软体的盛行，在与人互动受伤后，转而去网络上交朋友，彼此取暖。接下来就容易衍生较不理想的情感关系，甚至是受伤。
And because internet dating is very common nowadays, so these girls might turn to make friends on the internet, and it is easy to lead to a bad relationship and even get injuries for them.
那很感谢云林县政府给我们机会，在云林办理 CRC 儿少培力的这样的一个训练，让我们有机会借由这样的机会，不只是在我们自己的据点关怀陪伴这些有需要的女孩，可以到更偏乡弱势的海线地区提供课程。
Thanks to Yunlin government for giving us the opportunity to conduct the CRC training, so that we have the opportunity to not only care for these girls in our center, but also to more disadvantaged rural areas.
我们办这些课程呢，是提供女童自我形象的建立，认识自己的优点跟特质，肯定自己，学习爱自己，以及尊重他人。
And through the training, we want to enhance girls' self-image building, recognize their own strengths and attributes, affirm themselves, and learn to love and respect themselves and others.
也透过媒体识读、霸凌、禁止歧视等绘本还有影片，教导女童分辨假讯息，认识网络上的陷阱，懂得保护自己。
And also through the media literacy, bullying and anti-discrimination books and videos, teach girls how to recognize the pitfalls of the internet and know how to protect themselves.
以上是我们的报告，谢谢。
And this is our presentation. Thank you for listening.
Thank you, Ms. Tong. Thank you for sharing the rural girl experience that you're seeing on the ground, and also sharing a little bit that specifically highlights also the intergeneration issues and the new immigrant issues that are uniquely in the rural areas, but also highlighting the importance of self-empowerment for young girls, as Ms. Salas had mentioned also before that, oftentimes like young girls often internalize everything, and so they're at a higher risk of like mental health needs. Do we have any? I'm going to open up to the discussion for the participants first. Do we have any questions? If not, I guess I can start the conversation. So I'm going to start with Ms. Tong. I'll ask the question in Chinese, and then I can help you translate, or your translator can help you with the response. 所以唐小姐，你可不可以跟我们分？我知道这个，
Hi, Helena.
Yeah.
张觉老师, Professor Zhang is going to say something first and then go to the question. How
Okay.
about that?
Yeah, sounds good.
PowerPoint 是他放的吗？
对哦，但是我先要把那个贵军的那个，我先有点
所以
sorry，
你就先讲最军那个就好了，好不好？那待会儿
Yeah.
再说。
Okay, so because at first I'd like to share 贵军's in the language, the words, but I touched the other one. Also, it's supposed to present part of her presentation. But right now, I just like to read what she wrote to everyone because she's really in severe sick. She cannot have voices out. That's why she tried to write something. And okay, I just read her voice, her words. Then I can add something. Okay. Message from Hui Jun. Greetings, all participants online. I appreciate your attendance and excuse me for my sick leave this weekend. So the first message I bring to you about mental health is that it is okay to be not okay and express it. A Chinese proverb says, 9 out of 10 is unsatisfactory. It is life. That is the way the cookie crumbles. 人生不如意的事十之八九. But most of us live our life like performance, which makes human beings living not so real. The sick leave makes me embrace my limits and weakness. Then the topic I'm supposed to present to you is the policy and measures of child resilience. I say the policy, only single noun, instead of policies, because the only policy is making mental health a global priority by means of mainstreaming mental health in all policies to reach the goal of mental health for all. But for this, we might have dozens of measures for a different population. The example of the mental health literacy program for school mental health promotion is proven to be effective and efficacious for school kids, teachers, and parents in self-understanding, social-emotional learning, communication, problem-solving, and stress coping skill, recovering from loss and grief experience, and network connection, thus making participants of this program become more resourceful both inwards and outward in developing resilience. We initiate this program, the program by working with school librarians, parents, teachers, and counselors, while coordinating the intersection collaboration with the Ministry of Culture as reading promotion projects. The Ministry of Education cooperates with Family Education Center and the Ministry of Health and Welfare as school health promotion work. But as we know, when we mention literacy, it sounds very middle class. The mental health literacy program is accessible and appropriate for both well-nurtured children and family, and is available on most urban and rural campuses. The outcome and the impacts of this program are especially beneficial for those from the well-educated and nurtured family who are socially and culturally resourceful. So we keep reflecting and thinking about the way we practice in the program. Renewal stage, we target audience paired in one urban city and one rural county. These are all school-based strategies for program refinement. As for the institutional one, like girls in placement institution, we might have a radical change from the very beginning in building partnership with agency workers, in choosing specific material, in how we see what is mental health for disadvantaged ones, what kinds of adverse experience they experience, how to construct the content and access with trauma-informed perspective. This shall remind us to bring the model of building resilience into practice by being gender and culture sensitive. Finally, to all of us, health and wellness, peace and love. So I think we'd like to express this is the mental health literature program for school children. It's work by Mental Health Association, led by Ju Hui, already 4 years. So we from nothing to make the librarian go into the class to teach the children and make people understand what mental health related to them, the resilience, how to build that. It's not easy for the classroom children. So at this moment, we haven't really focused on disadvantaged children. We like to have this chance, share of our mental health literacy program, but work with Professor Yan and Ms. Tang and all of others. We should have the voices and experience by those girls. Then we can build what they need and those kind of resilience picture books. So this is what we're thinking about. We need to make the people understand their needs. Right now, we always give to them, but actually we need to understand what they want, their situation. Yeah, so I think this is Huijun and us, we like to show so people can go to the because I give you the PowerPoint. You can see the mental health literacy website. You understand more. But I will say everybody take a long time to acquainted with the work we done. And if we like to shift to the other group of girls, especially those disadvantaged girls, we need to really listen what they need. And also like Professor Yan and your group, you already observe them and accompany with them and see what they need. And also we have so many interaction and make the intervention both from the society part and individual part and the institutional part. Yeah, so I think I just like to say right now, we need to build resilience and also we respect those girls. They already have so many experience. They can survive till now. They already have their resilience. We really need to show respect to them and work with them with the whole program. Yeah, so thank you very much. Okay, it's okay? Okay. Yeah, thank you.
Thank you, Professor Zhang, for recapping or presenting panelist Wen's presentation. I was going to highlight that and then tie into the questions, but thank you for highlighting what she wanted to convey to us in her absence, and we hope for her speedy recovery. Since we're pressed for time, I guess I'm going to limit my questions to one per panelist, and since we're on the topic of mental health literacy, the importance of it, and especially in like school settings, I'm going to start, I guess, with Ms. Salas. And so I was wondering if you can like highlight, because like I think we're still sort of in a transition from like, in home, like virtual learning, like back into school. So can you highlight some of like the transitional needs that are uniquely during this transition from these girls at school? And then what are some of the promising, I guess, like girl-centered or youth-centered solutions that you're seeing to help what they need?
Some of the struggles that we saw when transitioning back into in-person was just the increased anxiety. Like, even though it's not a requirement in our schools anymore to wear masks or social distances, a lot of our students are still choosing to wear masks, just not for health reasons, just because of the elevated anxiety. It's more of a safety blanket for them. So we are also trying to identify those students who are still struggling a lot with that. And we've noticed that since so much shift has gone into virtual or digital forms of communication. Sometimes just very basic forms of communication is very difficult for our students. Like even ordering food from a restaurant, a lot of times you either do it on your phone or you have an app. So a lot of our students don't even feel comfortable asking people for basic needs or ordering foods or even asking questions, just because for over 2 years it all switched to digital. So all they had to do was type, all they had to do was fill out some online form. So that's been very difficult. And then also transitioning back, we did notice an increase of dropout in our female students, just because a lot of female students were tasked to take care of younger siblings or other household members if they were either younger or having mobility issues, or just older and need medical care. A lot of our female students just kind of stayed home and took on those roles. So we did see that. And then we also noticed that a lot of female students who were either victims of domestic violence or sexual abuse at home during this time, it was harder for them to make outcries and get resources, just because they felt like they were kind of stuck at home. So that those were kind of trends that we're trying to work on and see how we could best communicate with those, especially the students who never returned back to school during that time. And I did have I guess I didn't have a question for Professor Yin, but I did want to note that we also struggle in recruitment and retention of adequate staff. And that's also something that we're working on, just because we realize that it's very hard work dealing with these situations that our students go through. So that's also been a big struggle that we're trying to combat, and we're having difficulty filling those roles because not a lot of people want to do it because of the inadequate funding and just the tough work that it is trying to help these students.
Thank you. And then I guess my next question kind of ties into what Ms. Ellis was mentioning, that, there's like a specific transition needs, but also like the existing needs before. So I'm curious from Ms. Tong, like during I know the program is fairly new and since last year, but I'm curious, like, what are the responses that you're receiving for the girls that are receiving the self-empowerment training? So in Chinese, that would be 我知道就是你们的活动跟就是what is it？ 训练就是还是非常新，因为是从去年开始嘛。那就是目前为止，就是这些接受过这些训练后的女孩，她们的目前的感想，或是可不可以分享一下她们的经验？
这些女孩的经验吗？我觉得就是给他们一些机会，让他们更多的学会表达自己。因为平常他们在学校也好，或者是在他们自己的家庭里面，他们可能不是那么被重视，所以他们可能没有这样的机会有人听他说。所以我觉得在这样的一个活动里面，营造这样的一个环境，让他们可以表达他们的想法，透过我们的一些课程，让他们不断的去练习。那我觉得这个也是刚好也是符合儿童权利公约的这个儿少表意权的这个部分，让他们觉得他们的声音是被听见的，然后是有人愿意去倾听他们的声音，我觉得这一点很重要。谢谢。
Do you want me to translate, or I can go and translate? Okay. So I think Ms. Tong was sharing that it's just like this training or outreach program is just like giving the girls who are generally not being heard the opportunity to be heard, but also practicing using that self-empowerment techniques that they're learning to be able to share their stories and be confident to voice their perspective, so they can bring that at home. And then we'll go to Ms. Huang. I was curious because, like, I know because of the pandemic shutdown, like a lot of the social services that the population at the prison or correctional facility was completely cut off. And so you're not able to, and then, you know, the government wasn't really tracking the data of like what they need. And so now that it's getting back to, I guess, like slowly getting back to normal, what are some of the things that you have heard, you know, that this population express that they need, and what are some effective measures that you think the social services are being able to provide? Do you need it? I can translate the question as well. Oh, you're on mute.
OK， 你问的应该是就是我们社福团体在这段期间，然后因为监狱关起来的关系，所以其实好像能做的事情也不多嘛。然后你想知道我们到底可以干嘛这样子？其实坦白讲，这段时间我们真的什么都不能做，因为监狱那边的整个氛围其实是非常紧绷的，因为他们的人就是监狱内部的感染其实很严重，然后这些消息其实政府一直不敢正式的公布，那这些都是透过我们私下去获得的消息，然后当我们重新再进去监狱的时候，其实也可以感觉得到，就是大家都沉浸在一种很高压力的状态，而且看起来都很疲惫，所以我想有一部分是因为他们已经感染的关系，就是已经感染完疾病，或者是正在感染中。因为在我们的课堂里面有同学看起来是非常的不舒服，那周围的人其实都知道他感染了，可是没有人敢说，因为就是他们内部其实有个默契，就是不要去说，免得被隔离，因为隔离的空间其实根本就不够。所以到后面其实监狱也就如果不是非常严重的话，他们其实就当作没看到，就不要筛检。那我们其实回去监狱，然后看到那个状况了之后，其实我们坦白讲只能装作没看到，因为后面我们还需要继续跟监狱继续合作，而且我们知道，如果在我们课程中，然后上完课之后，那这些收容人如果表达出任何的情绪的不稳定的话，那个责任就会变成在我们身上，导致于我们后面可能没有办法再进去监狱提供服务，所以我们不能够在课程里面去针对这个议题去做太多的讨论，避免同学们开始他们的不满的情绪整个开始升高之后，其实会无法处理。然后今年我们重新我们预定是最近会开始进去监狱，那目前还不知道状况会是怎么样，但是我有私下去问一些监狱，那有一些监狱其实还没有完全恢复，就是疫情之前的正常的上课方式，所以到底是什么状况？其实状况是非常不明的，就是包括我们在CRC 跟 CEDAW 的国际公约里面，其实几乎都没有看到任何的资讯，即使有也都非常的少。然后，所以我想在这一部分，希望之后可以有更多的机会再去研究啦，因为现在真的感觉上那个疫情的状况还没有完全的消失，那国内有其他的国际上面的压力其实也一直在发生，这个是我们目前其实暂时看起来是无能为力跟紧绷的状态。Please.
Thank you for your I'll briefly translate. And so you reiterated like during the shutdown, like because they completely shut off all the social services, so there was really nothing that you can gauge on like what the prisoners like or the incarcerated population, what exactly they needed or what they were going through. And then I guess the official position was like they were also very reluctant to share exactly what is going on, which I think is you can see parallels, I think, in the US population as well. They're very hesitant to, you know, say that there's anything going wrong or and they're not getting the care that need or even like for basic like food needs. So I think that there's definitely parallels there from here and then also Taiwan. And now that you're slowly being able to provide the services, you definitely see a very high pressured environment still from the aftermath of like going through COVID and suffering from COVID, or even I guess like long COVID. And then you've seen a lot of the population experiencing like fatigue in general when you're providing these services or in class. But because you still want to continue to provide these populations what they need for social services, so you have to find a fine balance between, you know, giving what these prisoners need, but also not creating or raising too much advocacy, I guess, for the prisoners, because it is on the terms of these prisons or correctional facilities. And a lot of data, like you said, it hasn't been released or being tracked. So it's kind of like a wait and see situation. And then from your perspective, like obviously, like you want to be able to, because a lot of them have expressed like the need for like social engagement. So you're waiting to get for the prisons to open up for back to, I guess, like normal interactions. But there's still a lot of, I guess, uncertainty based on like the overall environment and also like the prison environment. So thank you again for giving a more in-depth
You're welcome.
picture of what's going on and the difficulties that you're trying to provide, and yet strike that balance to be able to continue to provide that. So we'll go ahead and like wrap up. And so my last question is to Professor Yan. So you definitely highlighted the need for gender impact analysis and some things that, and then, you know, to ensure like alternative care, which is like in the best interest of children. So I was curious, like, have you, since the last report was fairly recent, do you have any, I guess, like, share any like most promising progress that you've seen with some of the recommendations that the report highlighted for these alternative care or better comprehensive support for the vulnerable population?
I think a positive way is alternative care is a positive, but the gender impact analysis is from CEDAW report other than CRC. So I just addressed that issue in very beginning. On the rights of children, they hardly to focus on girls. So we try to advocate the statistics collecting gender analysis from the other way around. At least Taipei City government is become the next 4 years collecting the disaggregate data for gender analysis is one task. So hopefully we can work from city government to the central government. That's what I'm hoping we are working on. Thank you.
Well, I want to thank all the panelists for your participation, your input, and sharing the experience. I think that's very important for us to be able to, you know, to see what other people and what the people on the ground are seeing, and then giving us some additional maybe like pointers on what is working, what isn't. So thank you for all the panelists. And I think like what Professor Yan has said is correctly, you know, systematic issues continue to persist. There's definitely some positive, and the light at the end of the title, that, you know, there's a general awareness of like the importance of mental health, like literacy and mental health needs, like the needs for like the prisoners and the needs for like rural girls across, but there's still significant, I guess, under the patriarchal like society, that there's a lack of emphasis on improving or lowering the gap, decreasing the gap of like gender disparity across like different populations. So we need data, and we continue to need the people on the ground, and we need like continued positive, you know, discussions among ourselves to give each other social support to be able to like move on. And so thank you again for like the host organization, everyone for participating, and we'll see you next year.
Thank you.
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 Thank you, Erica.
Thanks.
Bye-bye.
Good night. Good morning. Good morning.
Thank you.